Hello guys, welcome back, and in this video lecture we will talk about the type of hypersensitivity. We know the four types, that is the gel and comb classification, which is type 1 anaphylaxis, type 2 cytotoxic, type 3 immune complex, and type 4, which is the delayed type. We also have a type 5 hypersensitivity that we will cover in this lecture. So let's talk about the hypersensitivity reaction type, how you can remember with the mnemonic, that is acid. You can remember the different type of hypersensitivity reaction with the mnemonic acid. A for anaphylaxis, which is type 1. C is cytotoxic, type 2. I is immune complex, type 3. And D is delayed, type 4. The first three, that is anaphylaxis, cytotoxic, and immune complex, they are antibody mediated. Antibody mediated means the antigen is going to come in contact with the antibody and there is going to be antigen-antibody reaction. So it is antibody mediated. That means when the antigen comes inside the body, when the antigen enters the body, then it is the antibody that is going to cause the hypersensitivity reaction for type 1, type 2, and type 3. We will talk about the differences when we discuss the different types of hypersensitivity. Type 4, on the other hand, is a delayed type. And it is cell mediated. That means B cells, T cells, all the cells that we have covered in the previous lecture that are going to participate in type 4 hypersensitivity reaction, that is a delayed type. So in type 1, 2, and 3, we are going to discuss the antigen-antibody reaction, while on the other hand, type 4 is going to be mediated by the cells, that is the B cells and the T cells. We also have a type 5 that we will cover in between. So the type 1 to type 3 is 1 is anaphylaxis, 2 is cytotoxic, 3 is immune complex, and 4 is delayed type. Now the first one, the type 1 hypersensitivity, is anaphylaxis. Anaphylaxis is what? Anaphylaxis is the allergic reaction. Also you can remember A for anaphylaxis, A for allergic reaction. So in case of any allergy that occurs in the body, in case of asthma is because of the allergen. Suppose if because of this allergen there is a hypersensitivity reaction, that is because of the anaphylaxis, that is a type 1 hypersensitivity reaction. So we will also cover the examples of these hypersensitivity, but let's talk about the type 1 hypersensitivity first. As I told you, A for allergen, A for anaphylaxis. Anaphylaxis means any reaction that occurs due to allergy. So what happens? Suppose if an allergen comes inside the body, or if a person is allergen to any substance, then it is picked up by the APC. In the APC, which is the antigen presenting cell, again we have covered this in the previous lecture. So APC has got what? A MHC molecule. APC has MHC molecule, and this MHC molecule is going to pick up the allergen. So this is the allergen. Allergen is placed on the MHC on the antigen presenting cell. So this is an antigen presenting cell. This is you yourself. Allergen is a glass of water. If a guest comes to your house, guest is what? Guest is T cell. Guest is T cell. So guest is the T cell. If the guests come to your house, you are not going to give this allergen, which is glass of water, directly in the hands. You are going to give the glass of water on the tray. Tray is what? Tray is MHC. So the purpose of this MHC is it is going to present the allergen to the T cell. So MHC is going to present the allergen to the T cell. This is the function of this MHC. So first, allergen is picked up by the antigen presenting cell. How it is picked up? Allergen is placed on the MHC. This is present on the antigen presenting cell. And then this allergen is presented to the T cell. Allergen is like a glass of water. It is presented to the guest. It is presented to the T cell with the help of this MHC. So it is presented to the T cell. And then T cell is differentiated into T helper cell. What is T helper cell? It is the CD4 T cell, which is the master regulator of the immune system. So in the T helper cell, we have talked about in the previous lecture, T helper cell 1, 2, and 17. So the function of T helper cell 2 is to produce the interleukin 4, interleukin 5, and interleukin 13. If you remember in the previous lecture, we have covered both of these. 5 and 13 has got a role in asthma. While on the other hand, interleukin 4 is going to participate in the isotype switching. What is isotype switching? A B cell has got two immunoglobulins, that is MD. M IgM and IgD. If you remember from the previous lecture, we have covered the B cell has got two immunoglobulins, that is IgM and IgG, and then it is going to convert it into all the type of immunoglobulins, that is G, A, M, D, E, and this conversion is known as isotype switching. It occurs with the help of two molecules. One is CD40, another one is interleukin 4, and we have remembered with the change. So these immunoglobulin M and G are changed into gamma D, and change Charles you can remember, change for char you can remember. So CD40 and interleukin 4. So interleukin 4 has got a role in isotype switching. Isotype switching. To understand this, you need to watch the previous lecture first. So then we have immunoglobulin E from here, and that is immunoglobulin responsible for allergy. Then interleukin 5 is the one that is going to activate the eosinophils. And interleukin 13 is going to produce the mucus. And both of these are going to play an important role in asthma. So we have immunoglobulin IgE. This immunoglobulin IgE is the one that plays important role in allergy. So you can remember E for allergy. This is how you can remember. So these IgE antibodies, they attach to the mast cell. So if this is a mast cell, this IgE is going to attach to the mast cell and it is going to sensitize the mast cell. So here is the IgE. So it is going to sensitize the mast cell. What happens when the second exposure of this allergen occurs? This whole process will not be repeated. See, if the allergen, first time the allergen comes, it is going to present it on the MHC. Then this allergen is presented to the T cell. Then the T cell has got T helper cell, which is CD4 T cell. Master regulator of immune system has got T helper cell 2, which is going to release interleukin 4, 5, and 13. And then interleukin 4 has got role in immunoglobulin E production. This immunoglobulin E, IgE is going to, antibodies are going to attach to the mast cell. When it attaches to the mast cell, this is known as sensitized mast cell. This sensitized mast cell, when the second exposure occurs, if suppose this is the immunoglobulin E, when the second exposure occurs, it is going to bridge the gap. So it is going to bridge the gap in the mast cell, and therefore this mast cell undergo polymerization. This is when the next exposure occurs. Next exposure, this one. Third exposure, this one. Fourth exposure, this one. Fifth exposure, this one. So basically when next time the allergen comes, it is going to polymerize the mast cell and it will cause the degranulation of the mast cell. Now this mast cell is going to burst open. This mast cell burst open. This is the mast cell and it burst open. So all the granule of the mast cells are going to cause degranulation. All the granules come outside and it is going to release a histamine. So it releases the histamine as the mast cell is a rich source of histamine. So it is going to release the histamine. Histamine is what? It is a preformed mediator. We have covered this in the pathology lecture. It is a preformed mediator. So what it is going to cause? It is going to cause the vasodilation. It is going to cause the bronchoconstriction, and therefore it will result in bronchial asthma. So this is how asthma occurs. This is the whole process of the type 1 hypersensitivity. How type 1 hypersensitivity occurs? When the allergen comes, it is going to get attached to the APC. How? It is presented on the MHC, and then this allergen is presented to the T cell. It attaches to the MHC. It is then presented to the T cell. T cell has got two types, CD4 T cell, CD8 T cell. CD4 T cells are also known as T helper cell. And a kind of CD4 T cell is T helper cell type 2. And this T helper cell type 2 is going to release 3 interleukins, interleukin 4, interleukin 5, and interleukin 13. Interleukin 4 is going to produce the immunoglobulin E, all the types of immunoglobulin, basically all the type of immunoglobulin by the isotype switching. So immunoglobulin E has got a role in allergic, and then it is going to get attached to the mast cell. It is going to sensitize the mast cell. When next exposure occurs, this whole of the mast cell. It will bridge the gap between the mast cell and it will undergo polymerization. Then it will cause degranulation of the mast cell. Mast cell is going to burst after polymerization. Once the mast cell is burst, it releases histamines. And what is the role of histamine? It is a preformed mediator. It causes vasodilation and bronchoconstriction. That means it is going to lead to asthma. So this is the whole process of the type 1 hypersensitivity. What is the special stain that is used for mast cell and basophils? We have studied in pathology, that is tolvadine blue. Something that we need to learn in micro. And type 1 hypersensitivity has got two phases. One is the early phase, another phase is the delayed phase. Let's talk about the early phase. That means it occurs early. Within 2 hours of the allergen coming in contact, we have early phase. Delayed phase is between 2 hours to 24 hours. That means 1 day. Up to within 2 hours is early phase and up to 1 day is the delayed phase. So type 1 hypersensitivity, early phase means it is occurring within the 2 hours. There are preformed mediators that are released, that is the histamine and tryptase. They are released from the mast cells because the mast cells degranulate. Mast cell burst open. So the mast cells preformed mediator are going to release in the blood, that is histamine and tryptase. So the patient with allergies will show a rise in the serum tryptase level. Also, there is going to be release of the histamine. This histamine will cause vasodilation in the blood and bronchoconstriction in the lungs, and that is going to cause the asthma. There are also newly formed mediators such as prostaglandins, leukotrienes, and platelet activating factors. So all of these mediator causes bronchoconstriction in the lung. Now, delayed phase of type 1 hypersensitivity. That means it occurs from 2 hours to 1 day, 2 hours to 24 hours. So, eosinophils important role in the delayed phase. See, I told you, the first one we talked about, interleukin 4, is immunoglobulin E. And that is going to play a role in the early phase of type 1 hypersensitivity. Then eosinophils are activated with the help of interleukin 5, which is released by T helper cell 2. These activation of these eosinophil plays a role in the delayed phase of this type 1 hypersensitivity. Basically, it is a type 1 hypersensitivity only. If this reaction occurs within 1 day, that is within 24 hours, then it is known as the delayed phase. And if it occurs within 2 hours, then it is known as the early phase. So basically type 1 hypersensitivity, which is occurring within 1 day. But if it is occurring within 2 hours, we call it early phase. Then we have a role of immunoglobulin E. It is going to release the mast cells. It is going to burst the mast cells and release the histamine. But if it is between 2 hours to 24 hours, then the eosinophil play important role, which is released by interleukin 5. So interleukin 5 is associated with it. And eosinophil releases what? Eosinophil releases the major basic protein. So this is the type 1 hypersensitivity. What is the difference between anaphylaxis and anaphylactoid reaction? Immunoglobulin E is involved in anaphylaxis, while on the other hand, anaphylactoid reaction is basically an anaphylaxis-like reaction. It is not anaphylaxis. It is anaphylaxis-like reaction. That means immunoglobulin E is not involved in anaphylactoid reaction. And this is the difference between anaphylaxis and anaphylactoid. So coming to the examples of type 1 hypersensitivity, you can remember with the mnemonic A, B, C, D. This we have already covered, but let's talk about once again. A for allergy, any kind of allergy. Or A for atopy. Atopy is also kind of allergy. B for bronchial asthma. We have covered whole mechanism or the pathogenesis of the bronchial asthma. C is Cassoni test. We do not do the Cassoni test nowadays, but it is done for hydrated cyst. And D for drugs. For example, if you give penicillin to a patient, sometimes the patient has allergy to penicillin. So how are you going to test it? With the help. So basically, if the penicillin shows the allergic reaction, then we do this test. So D for drugs, to check the allergy due to any drug. So to check the drug allergy, we see the type 1 hypersensitivity reaction, we do the test. So like the penicillin test is done, similarly we do the test for any drug allergy, for example PK reaction or Theobald-Smith phenomenon. So all of these comes under this. So the mnemonic to remember the examples of type 1 hypersensitivity, it is A, B, C, D. Very easy. All the allergies we are going to cover. Either it is allergy, due to any dust, allergen, anything that is any kind of allergy. For example, allergic dermatitis, for example, rhinitis, pollen allergy, for example, conjunctivitis. And remember, another name for allergic conjunctivitis is known as vernal keratoconjunctivitis. And what we give in this olopatadine, in fact, because of the more screen time, my husband used to give me olopatadine eye drops because of the allergy. I used to have papillae formation in the eyes, and that is going to cause pain in the eyes, pain, dryness, all of these. So the olopatadine drug is basically a mast cell stabilizer. See, I told you what happens. This bursting of the mast cell is going to release the histamine. This olopatadine will not let the mast cell burst. And that is how it is a mast cell stabilizer. It is a new drug. It comes as eye drops. So it also has antihistaminic property, and that is why we give for the vernal keratoconjunctivitis, which is basically another name for allergic conjunctivitis. Another A is atopy. Atopy is allergy with a genetic determinant. That means, suppose if there is a family history of allergy, sometimes you have seen some people with peanut allergy, or going to some hilly station, or with a test, some people, keep on sneezing and coughing, and that runs in the family history. That is atopy, allergy with a genetic determinant, that is family history of any allergen. And chromosome 5 is associated with atopy. Coming to B is bronchial asthma, and we have covered this. C is the Cassoni test that is done for detection of Echinococcus granulosus. It is hydrated cyst, and this test is not done nowadays. It is obsolete. D for drug, in case of a drug allergy testing. For example, test is done for penicillin allergy or some hypersensitivity reactions that include drug allergy such as PK reaction or Theobald-Smith phenomenon. Both of these are also obsolete. Coming to type 2 hypersensitivity. So what we have studied so far in type 1 hypersensitivity, that if any allergen comes, this allergen is going to be picked up by the antigen presenting cell. This antigen presenting cell, as the name suggests, this is going to present the antigen, right? Antigen presenting cell. In the name itself, it tells that it is going to pick up the antigen and present it to the T cell. But what part of this APC is going to present to the T cell? It is the major histocompatibility complex, which is the MHC. MHC is like a tray. It is going to present this allergen to the T cell. Then we have CD4 T cell, which is also known as T helper cell. We have type 2 T helper cell that releases interleukin 4, 5, and 13, and that is going to play a role in the hypersensitivity. Type 1, because the interleukin 4 plays a role in isotype switching, so it will cause the B cell to produce all the immunoglobulin. Out of that, IgE is the one that plays a role in the anaphylactic reaction. So IgE is going to get attached to the mast cell, and mast cell is going to burst open, and it releases the granule, it releases the histamine, and therefore we see all the things like, for example, histamine causes bronchoconstriction and vasodilation, and it is going to cause the asthma. So this is a mechanism that we have studied. What are the examples of type 1 hypersensitivity that we have studied? It is A, B, C, D. A for any kind of allergy, for example, allergic dermatitis, allergic conjunctivitis, allergic rhinitis, all the allergies. Or atopy is also kind of allergy that runs in the family. B is the bronchial asthma that we have covered. C is Cassoni test, and D for any drug test, drug allergic testing. Coming to type 2 hypersensitivity. See, I told you type 1, type 2, and type 3, all three are antibody mediated. So type 2 is also antibody mediated, and we have three mechanisms. One is opsonization and phagocytosis. Another one is antibody dependent cellular cytotoxicity. And the third one is complement activation and inflammation. So let's talk about all these three first. Three mechanisms of type 2 hypersensitivity. The first mechanism is, if the antigen comes, it binds to the antibody, and there is antigen and antibody reaction. Then to this reaction, immunoglobulin G comes and binds to it. And then it is going to cause opsonization. It is coated. Opsonization, it is coated, and then it is engulfed, which is phagocytosis. Phagocytosis. So this is the first mechanism of type 2 hypersensitivity. Another, in the name itself tells that antibody dependent cellular cytotoxicity. So immunoglobulin G that is coated with the antigen, this is antigen, and it is coated with the immunoglobulin G. It is coated with the immunoglobulin G. It is then identified by NK cell. It is then identified by NK cells and macrophages. And then it will result into antibody-dependent cellular cytotoxicity. Then the third mechanism is again antigen and antibody reaction is there. And then it is going to activate the complement system and cause the inflammation. So these are the three mechanisms of the type 2 hypersensitivity. All of these, there is antigen antibody reaction. When the antigen comes, antibody is present in the body and it is going to either causes opsonization and phagocytosis, or it is going to first the antigen antibody reaction is there. In the first, IgG binds to it, and then there is opsonization, that is coating, and engulfment, that is phagocytosis. Antibody dependent cellular cytotoxicity, this antigen antibody complex is identified by NK cells and macrophages, and then it will result into antibody dependent cellular cytotoxicity. So basically NK cell and macrophage are going to eat it. Then the third is complement activation. This antigen antibody reaction can activate the complement system and cause inflammation. So these are the three mechanisms of type 2 hypersensitivity. Now the examples of type 2 hypersensitivity, you can learn with the mnemonic, that is my blood group is Rh positive, Rh positive. My is myasthenia gravis. Blood, you can remember any blood transfusion reaction. Group is good posture syndrome and Graves' disease. Is immune hemolytic anemia or immune thrombocytopenic purpura. RH is Rh incompatibility, and positive is pemphigus or pernicious anemia. So these are the examples of type 2 hypersensitivity. My blood group is Rh positive. This is the mnemonic that you can remember all the examples of type 2 hypersensitivity. My blood group. My is myasthenia gravis. Group is blood transfusion reaction. Blood is blood transfusion reaction. Group is good posture syndrome, which is a kidney and lung disease. Graves' disease is a thyroid disease. Then is immune hemolytic anemia. So basically, immune hemolytic means there is going to be hemolysis of RBCs. RBCs are going to break down, and because of any immune reaction, so antibody breaks the RBC. Immune thrombocytopenic purpura means platelet breakdown due to immune or antibodies. RH incompatibility, that means wrong RH blood group is transfused or given to the individual. P is positive for P is pemphigus, that is bullous form of pemphigus, and pernicious anemia, which is B12 deficiency or the megaloblastic anemia. Now, myasthenia gravis, all the Graves, myasthenia gravis and the Graves' disease, both of these, they now comes under the type 5 hypersensitivity reaction. Why? Because both of the two Graves, see, what is myasthenia gravis? And myasthenia gravis antibody is against the acetylcholine receptor. In the Graves' disease, antibody is against the TSH receptor. So both of these, in case of Graves' disease, the antibody is against the TSH receptor, and it is going to stimulate the thyroid. So there is going to be increase in thyroid action. There is going to be classical hyperthyroidism. So there is going to be increase in the thyroid seen in case of Graves' disease, classical hyperthyroidism. Therefore, it is also known as thyroid stimulating antibodies, which was previously known as LATs, that is long acting thyroid stimulator. So basically there is going to be increase in the action of thyroid. Why? Because the antibodies are formed against this TSH receptor. So antibodies act like stimulator, and it is going to increase the thyroid action, increase the thyroid hormone. So basically in both of these diseases, the antibodies are against these receptors, not the molecules, against the cellular receptor. And that is why we have classified it under as type 5 hypersensitivity reaction. So type 5 hypersensitivity reaction, antibodies are against the cellular receptor, not the molecules, the cellular receptors. So in type 5, antibodies are against the receptors that you need to remember. And the examples of type 5 hypersensitivity, you can remember all the Graves. For example, myasthenia gravis and the Graves' disease. Coming to type 3 hypersensitivity, this is also antibody mediated. If you can recall, 1, 2 and 3, all are antibody mediated. So type 3 hypersensitivity is also antibody mediated, and there are 3 phases. It is immune complex disease we have covered. It occurs in 3 phases: immune complex formation, immune complex deposition, and then complement activation. And all of these three phases, they are covered or done in 10 to 14 days. So the duration of all the three phases is 10 to 14 days. So first one is immune complex formation. What happens? Immune complex is formed. That means the antigen antibody complex formation takes place. And here both of these antigen as well as antibody are mobile. So this complex is also mobile. And then this complex is then deposited in the organ. This antigen antibody complex is roaming, and then it is deposited in some organ or joint or skin or serosa, and then it is going to create the problem. So this deposition is going to create problem. Usually the medium size complement or complexes are the ones that are going to cause more problems. Then it is going to activate the complement system and causes signs and symptoms in the body. So this is the type 3 hypersensitivity, which is immune complex disease. So basically this immune complex is what? Antigen antibody complex that is going to cause the problem. First, this antigen antibody complex is formed. And now the difference between type 2 and type 3 hypersensitivity is in type 2 hypersensitivity, antigen is fixed. Antigen is fixed. Either it is fixed on a molecule, it is fixed on a cell. So basically this antigen is fixed and antibody is roaming around. But here in type 3 hypersensitivity, both of them are mobile. And in fact, this antigen antibody complex is also mobile. So this is the difference between type 2 hypersensitivity and type 3 hypersensitivity. In type 3 hypersensitivity, this antigen antibody complex is mobile, antigen is mobile, antibody are mobile. And in case of type 1, antigen is fixed. But in case of type 3, antigen is mobile. So this is the difference between type 2 and type 3 hypersensitivity. And then this complex is deposited somewhere, either in the organ or in the joints or skin or serosa, anywhere, and it is going to create the problem by activating the complement system. So this is the type 3 hypersensitivity. What are the examples of type 3 hypersensitivity? You can remember with the mnemonic, that is sharp. So mnemonic for type 1 hypersensitivity is ABCD, allergic reaction, all the allergies. Type 2 is my blood group is Rh positive. And from that, we have also studied the type 5 hypersensitivity, that is the Graves. So myasthenia gravis and Graves disease. Type 3 hypersensitivity example is sharp with the mnemonic sharp. You can remember S for SLE, serum sickness or sheet test. H for Henoch, Schonlein, purpura. A for Arthus reaction, R for Raji assays or reactive arthritis, and P for post-streptococcal glomerulonephritis or polyarthritis nodosa or complication of any parasitic disease. So the examples of type 3 hypersensitivity, the first one is SLE, autoimmune disease, SLE, butterfly-like rash. Then serum sickness, it is excessive injection of anti-tetanus serum or excessive injection of anti-rabies serum is going to cause the serum sickness. Sheet test, it is a test that is done for Corynebacterium diphtheriae. This we have also covered in the micro. Henoch, Schonlein, purpura. This is immunoglobulin A vasculitis that occurs in the children. Arthus reaction, localized immune complex disease. Raji assay or reactive arthritis or post-streptococcal glomerulonephritis. In this, there is cola color urine that is seen. Polyarthritis nodosa and complication of a parasitic disease. It is not the parasitic disease, complication of the parasitic disease. For example, if a person is having malaria and the complication can result in nephrotic syndrome, it can affect the kidneys. So this is an example of type 3 hypersensitivity, not the parasitic, the complication of the parasitic disease. So let's recall all the examples of type 3 hypersensitivity with the mnemonic sharp. S for SLE, S for serum sickness, and S for sheet test that is done in diphtheria. H for Henoch, Schonlein, purpura. A for Arthus reaction, R for Raji assay, another R is reactive arthritis, and P is post-streptococcal glomerulonephritis or polyarthritis nodosa or parasitic disease complication. Now coming to type 4 hypersensitivity. We have discussed type 1, type 2, type 3 are antibody mediated, while on the other hand, type 4, which is a delayed type, it is cell mediated. In fact, it is the only cell mediated hypersensitivity because rest all are antibody mediated. This is the only cell mediated. And in the previous lecture, we have studied the cell are CD4 T cells, CD8 T cells, both of these cells. CD4 T cells, if you can remember, these are the helper T cells, while on the other hand, CD8 T cells are cytotoxic T cells. And if you can recall CD4 to CD8 ratio from the last lecture, it is 2:1. Let's stick to this topic, which is type 4 hypersensitivity. So antigen presenting cell is going to first pick up the antigen. This is the antigen presenting cell. It is going to first pick up the antigen, and this antigen is then presented to the T cell via this MHC. This is the antigen, and on MHC, it is then presented to the T cell. Then T cell has got T helper cell type 1. Now, if you can remember, in the type 1 hypersensitivity, it was T helper cell type 2. Here it is T helper cell type 1. So T helper cell 1 is going to release the interferon gamma, and that is going to cause the granuloma. So this is the type 4 hypersensitivity reaction. So in case, first of all, we have talked about CD4 T cell. Now we'll also talk about the CD8 T cell. So let's talk about CD4 first. CD4 T cell. In the CD4 T cell, we have T helper cell type 1, and it is going to release interferon gamma that is going to cause the granuloma. So first, this antigen is picked up by the antigen presenting cell. It is then presented to the T cell on the MHC molecule. Then T cell, which has got T helper cell 1. Remember, in type 1 hypersensitivity, it was T helper cell 2. Here it is T helper cell 1. And it is going to release the interferon gamma, and it will form the granuloma. CD8 T cell, which is a cytotoxic cell, it works via apoptosis and perforin granzyme pathway. This we have covered in the previous lecture. So type 4 hypersensitivity examples are all the things that are going to include granuloma. First, granuloma itself, or any skin test like Mantox test done for TB, lepromine test done for leprosy, or inflammatory bowel disease, multiple sclerosis, contact dermatitis. Worldwide, we have the poison ivy, that is a plant poison, and in India we have, because of the poor detergent powder, any allergic to the detergent powder or allergic to the artificial jewelry, for example nickel and cadmium that is present in the artificial jewelry causes allergic reaction or type 4 hypersensitivity in some individuals. So type 4 hypersensitivity examples include granuloma. Granuloma formation is there, that is because of the interferon gamma, and that is released by T helper cell type 1. Or skin tests such as Mantox test, lepromine test, inflammatory bowel disease, multiple sclerosis, contact dermatitis. Contact dermatitis worldwide, it is poison ivy, that is from a plant poison. But here in India, we have contact dermatitis either due to detergent or due to artificial jewelry. So this covers the type 4 hypersensitivity. Type 5 hypersensitivity, we have already discussed all the Graves, such as myasthenia gravis or Graves disease. Myasthenia gravis, the antibodies are against the acetylcholine receptor, and in the Graves disease, antibodies are against the TSH receptor, and it is going to in fact stimulate the TSH receptor, and therefore thyroid hormone is produced more, and therefore it is hyperthyroidism. So basically, in type 5 hypersensitivity, antibodies are present against the cellular receptors, not the molecule, it is the receptor. So if in a multiple choice question or if in exam it is asked, suppose if in exam myasthenia gravis is asked, it is which kind of hypersensitivity? If in the option type 5 hypersensitivity is there, then it is the correct option. If type 5 hypersensitivity is not there, then you mark type 2 hypersensitivity, because earlier it is used to come under type 2 hypersensitivity. So first or best option is going to be type 5 hypersensitivity, and second best is type 2 hypersensitivity. Similarly, certain times it is asked in the exam for SLE. If you remember SLE, we have studied in the type 3 hypersensitivity, which is the sharp SHARP. But for SLE, the first option is going to be type 3 hypersensitivity, and the second option, if it is not given in the option, then we mark the type 2 hypersensitivity. So these are the examples of hypersensitivity, the mechanism of hypersensitivity that we have covered in this lecture. All the best, guys.